Hello there, everyone. Thank you so much for joining us, and thank you, Sonny, for coming back to for another Joint School interview.
Good afternoon, Axel. How are you? Are you well?
I'm very well, thank you. But more importantly, how are you doing today?
Yeah, I'm fantastic. I'm feeling great. This is 7 weeks after my operation.
Yeah.
So hopefully in this video we can have a good chat around how the last 7 weeks have been.
Yeah, absolutely. So we are both, a few weeks older, a few weeks wiser, hopefully, than in the previous video.
Yeah, a few kilograms heavier. Well, I speak for myself, but yeah.
Well, yeah. Well, most importantly, that's exactly it. So you have had your hip replacement. You're now beyond that important 6-week milestone, which many watching this will encounter as a bit of a key point in the recovery, and we'll reflect back on that. And so here we are. You're now 7 weeks on and counting. And before this interview, you've had a look at the video that we recorded before your operation, which will also be, of course, be available here on our YouTube channel. And what was it like looking back on your thoughts, ideas, and expectations as they were before the operation?
Well, I think on look back, I think in hindsight, I think the 3 areas that I picked out, and just to recap the audience, were what type of procedure was I going to have, posterior, anterior, etc. And it's all available in the other video. What was going to be the anaesthetic that was going to be applied to me around the pain relief, and then the aftercare. I think they really were the 3 key areas that I should have focused on, which I did. In hindsight, I think there were 2 key things. So if I had to go back, that I would have added into the plan, which could help the viewers. So the one big area that I guess was an unknown, or as I said, an unknown was the amount, the quantity, and the complexity of some of the medications that were going to be prescribed to me as a day case patient. So I came home and I was given 12, 15 boxes of meds. And a lot of those meds were very, very new to me in terms of not being from a clinical background. So in hindsight, I probably would have done some more research and asked some more questions around what the meds were that would have been given to me. What was the function of those meds, such as codeine, and there was some really, really strong painkillers you had to take the first 3 days. And more importantly, what were the side effects? Because I did suffer quite a few side effects in that first week, which is natural for some of these medicines, especially things like codeine, which makes you very, very constipated and brings on the sweats. So I had to learn all that as I went along the process rather than doing my prep. So I wasn't prepared for any of that. So that was the first thing. And the second thing was, that first week was quite tough in terms of the stresses on the joint and the fact that the muscles had all been cut away. So my body was just reacting to effectively, something invasive in my body and trying to heal some of those tendons. So if I'd done a little bit more fitness and, carrying a few kilograms, not too many, but, if I could have lost a few more kilograms, I would have made life a lot easier for myself, trying to get out of bed and move around and be mobile. So they're the 2 key things, I guess. If I had to go back and rewrite that video or the plan for that video, I would have incorporated Axel.
Okay, that's interesting, and I suppose that's then worth sort of flagging as a message from this video, in terms of the medications that you were given after surgery, and that people watching this video will be given after their operations, and of course that will vary from hospital to hospital and depending on many personal circumstances. So the key message there perhaps is to make sure that before you leave the unit or the hospital, to speak with a team or the pharmacist if they're available about what exactly are the medications that have been prescribed, how long for, how much am I being given, what are the steps I will need to take when I run out, and those kind of questions. Absolutely,
and make sure you try and engage with your consultant and your anaesthetist to ask those questions, because the other learning is you have to make sure that the meds are prescribed by the pharmacy. That's the model within the hospital. So you owe it to yourself just to make sure that whatever the pharmacy prescribed you from their crib sheet is actually in sync with what the surgeon and the anaesthetist is prescribing you. because sometimes they do vary. And you don't forget, we're trying to find new ways of working here, the new norm, day surgery. So sometimes those list of meds could be out of sync, because obviously the pharmacy will work off a script where people are inpatients for 2, 3, 4 days, etc. Whereas it's now a slightly different model.
Yeah, absolutely. So I guess well pointed out that it's worth perhaps flagging that, particularly if you're on a pathway for day case hip replacements, if you're going home the same day.
That's right, because it will be a totally different sequence and a set of meds for day surgery patients versus if you've already been admitted.
Yeah. And then I'm sure people watching this will have encountered the idea several times that it's important to keep active little and often, but it's also about finding that balance, right? Not doing too much too soon, and trying to keep active and finding that balance. But that really does make a difference. And you also highlighted about losing a few excess pounds in kilos. Now, without going into that in too much detail, I think there's most people would advise against any sort of crash diets or anything like that before surgery, but certainly it can make a difference to lose a few extra pounds and kilos if you have the time to do so in a sort of safe and sustainable manner in the weeks and months leading up to an operation.
Yeah, and I think just to add to that, I think and I think a lot of viewers will relate to this, and I can say this because I've lived through it. I don't think it's necessarily too much, Axel, around the physical aspects of finding time, etc. I think it's more of a psychological, mental thing, and let me explain. So what happens is when you are suffering from osteoarthritis and you've got a lot of hip pain, and every day you wake up, you're on naproxen, and just to put your socks on is a mission, and just to climb stairs is a mission. The last thing you want to do is exercise. Just psychologically, because your body's already, you've got a bone-on-bone condition, and just to do any kind of exercise or you definitely can't run, but just to walk, 20-30 minute walk, you can come back and you can be quite sore in the joint. So I think it's difficult to get over that psychological step, but I do think it's worth it because you do have to push yourself, and there is I'm not going to sugarcoat it, there is a slight pain barrier you will have to go through. So I think it's more of a psychological thing, more than anything, if you've got a condition. But that definitely helps if you can lose a few pounds. Yes.
Well, so to get back to your personal experience then, Sonia, can you walk us through what was it like? So when we left you were a few weeks ahead of surgery.
Yes.
It was coming up, and how did things progress from there? What was it like just before? What was your day of surgery? Was it different from what you expected?
Okay, yeah, sure. So, obviously when we last spoke, it was probably a week or so before surgery.
Everything, yeah.
So that, that last week, as the time came nearer, it was a little bit daunting, because it's a little bit of the unexpected, because you don't really know what to expect, so you do get a bit nervous, and but the best advice I can give people is not to listen to the crowd, because people will give you 10 different opinions, etc. And some will say, oh look, you're going to come out and you're going to be in a wheelchair for about 6 months or whatever. These people have just no idea. So try not to listen to people, try and just keep yourself as healthy as possible, as fit as possible, which is what I try to do. And then the day of the surgery, look, it was as expected. I got there at 7:30. Very well controlled environment. Done the procedure, got signed in. Got given the anaesthetic pretty much straight away around 9 a.m. That was via a spinal procedure. If you have that procedure, don't worry. You will feel nothing from the waist down, but I promise you this: your senses will come back. It feels like they're not going to come back ever, but they will come back. So don't panic. It's all part of the procedure, and you won't be able to feel anything. And then my surgery was around 10:30 a.m. And the procedure itself takes about an hour and a half to 2 hours. And don't worry, even though you're localized and you are awake, you're not actually fully awake, because you do get a drip put into your hand. So they can control the level of drowsiness by giving you some temporary
It's like a sedation or like calming medication, and that's very much a decision, by the way. That's a conversation between yourself and your anaesthetist.
Exactly. And for those of you screamers, you don't actually see anything because for example, I was operated on my left hip, which meant I was lying on my right side, so I was facing this way, so I couldn't actually see what was going on behind me on my left hip. So it's not like you're watching anything, and because you're paralyzed anyway, or you can't feel anything, there's, as far as you're concerned, there's not much happening. So don't worry about any of that, and you can ask for more sedation if you really just want to be put to sleep. So that all went great, Axel. I then came out of the surgery. I mean, the other, I guess, the learning I should share is that be prepared for things to happen quickly. And what I mean by that is, time is of the essence, because you're literally there in the morning, and the aim is to discharge you by the evening. Mm-hmm. So I came out of surgery about 12:30, and had a quick cup of tea and a sandwich, because time is of the essence, and they just give you enough anaesthetic so it starts to wear off quite quickly. By about 2 p.m., I had the physio guys in around my bed, and around 2 p.m. they were trying to get me out of the bed, literally a couple of hours after the operation. And they had me on the A-frame trying to at least feel my feet again. And by about 4 p.m. I was climbing up and down the flight of stairs on crutches. So all that happened within 3 to 4 hours of coming out of theatre. And if you're not prepared for that, it does catch you off guard a little bit, because you're not prepared for things to happen that quick, because you'd like to think you have more time to recover, but you don't. But those 3 or 4 hours are pretty hard, because your body is still semi-numb. You've still got pins and needles. So you'll start to get pins and needles when the stuff wears off, the anaesthetic. And then you'll be asked to do certain procedures. Now, guys, it's very important that you comply and you try to follow those procedures, because they are, as I found out on the day, there's certain markers that you have to meet, such as being able to go down the stairs and come up the flight of stairs with your crutches before you can be safely discharged. Otherwise, you're not eligible for being discharged. And obviously, they take your blood pressure, etc. So I got home about 7 p.m. and I felt fine. And then I just went to bed. So to answer the question, the day went perfectly smoothly. They've got a great team there at West Mid. Arj, my surgeon, who's great, and they made me feel very comfortable. And the fact they got me out the same evening, having met all the markers, is a great testament to their expertise.
Fantastic.
And so that was that. And then going into the first week, just quickly. So again, be prepared for this, guys. The first 3 to 4 days is difficult. I'm not going to lie to you, because the next morning a lot of the anaesthetic would have worn off. You're now very reliant on those prescriptive drugs, the ones we talked about earlier. So don't be disheartened. The first couple of days is going to be difficult to try and move out of the bed, because trying to put pressure on that leg, which is still very swollen and very angry in terms of the muscles and the joint, just trying to get into place, is very difficult. Make sure you use the A-frame. And don't put too much pressure on yourself to do too many things too quickly. You're going to need some help around the house. Get people to get you whatever you need, and just slowly start doing the bed exercises that will be prescribed to you by just trying to move your leg up and down, or rolling the ankles. And then give it 2 or 3 days before you can comfortably start to get out of bed and have some movement. In that first week. So that is quite difficult. But the only other point I want to say, well, 2 points. One is recovery after that first 3 or 4 days to the first 3 or 4 weeks. Recovery is what I call exponential. So you'll feel really, really deflated this first 3 or 4 days, because it is very painful. It's very sore. You might have some side effects from the meds, which are primarily sweating, not being able to sleep because of the pain, but nausea and constipation, because codeine does make you constipated. So,
and it's not unusual to feel a bit sort of down in the dumps in those first few days, just generally.
Yeah, exactly, because you can't do anything for yourself. You are bedridden. You are in pain. I mean, I'm going to be honest with you, Axel. I literally got no sleep for the first 4 or 5 days, because because you effectively lying on your back, and you can't lie on your operated side, and you can't really lie on the opposite side, because it pulls on that muscle along your thigh. and it's quite painful. So, I was just getting naps during the day, lying, sitting on the sofa, etc.
Okay, well, so you were able to nap during the day at least, and
yeah, I tried to, yeah, exactly. So you do need to take a bit of time off, so you can give yourself that leeway to kind of just recover. But then, as you get into week 2 and 3, my recovery was a bit more exponential, where you start to feel better quite quickly, and the pain starts to subside quite quickly as well, as the muscles go into recovery mode and the prosthetic starts to just settle into your body. So that's quite good. And then the other second point I want to make is, even though you'll start to see progress quite quickly, recovery is definitely not linear. So just because you're starting to see progress, it's not just linear smooth like that. What will happen is it's kind of like that, up and down. So you'll get better. You'll make the decision to start doing a bit more, maybe going for a long walk, or just trying to do some grab the back of the chair and just do some gentle squats. But you've got to remember, your muscles are still very tender, your ligaments are still very tender. All it takes is a little bit of overzealous exercise, and you may inflame some of the muscles. So I got a bit of bursitis, where I had quite a painful sort of area at the top of my hip, and that took me about 4 or 5 days to recover. But that didn't happen for me until week 4 or 5.
Okay, yeah.
So that put me back a bit, a week or so. So that can be a bit psychologically disheartening, but again, it will ease off again.
Yeah, so and I guess it's worth highlighting for anyone watching this who wants a bit more of a sort of real-time blow-by-blow account, that you've been keeping a really interesting and I think really helpful journal on Instagram. With more regular updates, and we'll make sure that the link to Sonny's Instagram account is here below the video.
Yeah, definitely, guys. So follow that link. Hip pain problems, but Axel will post that, and feel free to DM me, message me if you need any advice, or I can help in any way, because I've been through that journey on a day surgery basis, and I've got the scar to show it as well.
Yeah, literally.
And literally, yeah. So if I can help anyone, that's great. I mean, the one thing we should quickly talk about is the scarring itself. So again, don't get alarmed by this as well. So you will have, when you come out of hospital, you will have a pretty big dressing down the side of where the incision's been made. Don't be alarmed by that, because the dressing will be a lot longer than the actual scar is.
Yeah.
So you come out and you think you've got this like 10-inch dressing down the side of your thigh. Your scar's not actually going to be 10 inches long, guys. It's just the coverage of the dressing, and that dressing will normally come off after 2.5 weeks, 3 weeks, and then what you might find is the scar is still, although sort of semi-healed, still a bit sore to the touch. So what I found was I just bought myself some of this, well, there's two schools of thoughts where it works or not, but I bought some of this bio oil gel, and I just gently rubbed it in to the scar. And then what you find is initially the scar's a little bit raised, just how it closes up. But if you constantly gently massage it, you start to see the raising of the scar start to settle down. So that's healing away quite nicely. But again, don't expect miracles. It'll probably be, I don't know, so you're probably more experienced, probably 6 months before we see the full effects of that scar calming down and getting to its permanent state. I don't know.
Yeah, no, it can take time, and it can also keep improving over quite a significant amount of time. Certainly the oils and lotions and things like that can help, but a little bit of a flag there is that it's worth checking with your surgeon to make sure that the wound is reviewed before you start applying bio oils, lotions, and things like that, just to make sure that everything is like healed up and that it's ready for that stage. But certainly lotions, bio oils, what's called scar tissue massage can be helpful, and that's something that your surgeon or physiotherapist can advise on, and you may also find some videos online as well that can help to guide that process as well.
Yeah, that's it. And so the final point I'll make is now week 7, recovery is happening. I'm not going to say it's fully healed or recovered, because obviously I still feel the odd twinges of pain, and the muscle's definitely not as strong as my other leg, and that will just take time to come. But one bit of advice I would give people, if they can get to it, I mean, in week 6, at the end of week 6, I've now started what I call some sort of hydrotherapy. So I found myself a local swimming pool, and I just try and get into the pool 2 or 3 times a week. And all I do is just, rather than swimming, I just walk up and down the swimming pool, and just with a bit of resistance with the water. And I try to do just about 10 or 15 laps, just walking up and down the swimming pool. So I do that just to do a little bit of resistance walking, if you want to call it that, or pool walking. So I do a bit of that. And then what I find has really helped my scar is they've got a little, is it hydro pool? What they call those little jacuzzi things, the hot tub things, And then I just give myself 15-20 minutes, and I just sit in the hot tub.
Well, that sounds quite all right.
Yeah, really nice, and it just soothes the aching muscles around the hip, And then I get out, have myself a nice hot shower, and that's my therapy done for the day. Really, I don't do more than that at the moment.
Yeah, excellent. So softly, little and often, and sort of gradually building things up. And so at this stage, then, sort of 6-7 weeks on, if we were to say, sort of roughly speaking, from 0 to 100%. 100% being, as good as your other side on a good day. Where would you say you are now from 0 to 100% in sort of your recovery?
I'm probably about 70%, Axel, to be honest with you, which is not bad for 6-7 weeks. 70%.
Yeah.
And what's good? I mean, I can easily go and do a half an hour walk now and have a stroll without feeling any discomfort or any pain. I can climb flights of stairs easily without feeling any pain. What I can't do, still 100%, which is that 30% we're talking about, is the muscle is still tight because it's still healing. Yeah. So the external rotation, i.e., trying to lift my leg up and put it over my other knee, is still difficult because my external rotation is still limited. But I think with massage and a bit of physio, that will get easier over time. Yeah. Obviously there's still pain towards the top of the hip if I overdo it, and the tendons are still, I guess, healing in a way.
Yeah, absolutely. I mean, it takes time. It's a fairly big deal to have a new hip joint, but to be, as you say, at about 70%, roughly speaking, by 6-7 weeks. Yeah, is quite impressive. Again, really important to flag for those watching this who may be whether you're getting ready for surgery or you're on the road to recovery. Please do not be disheartened if you don't feel that you're at 70% by 6 or 7 weeks, because it's so individual and it depends on so many factors. But hopefully, what we're able to do here through this interview is to shine a light on your experience, Sonny, and what it's been like for you, and that will then feed into a greater body of understanding and knowledge, hopefully. But it shouldn't be, you yourself have mentioned a few times that how important it is not to compare yourself directly to someone else, but Absolutely. To look at other people's experience and see, okay, perhaps I can learn something from there. Perhaps that will inform what I may expect, but don't compare yourself sort of like for like with another person.
Yeah, exactly. And again, I guess on a passing note, the final piece of advice that I'd like to give everyone, and this has happened to me because obviously I've lived through it, as you go through the first 6 weeks, which are pretty critical, and experience all these different little niggles and little pains and little bits of swelling, the immediate reaction is to think that something's happened to your joint. Has it moved? Has it, it's uncemented? Has it moved out of position? Has it dislocated at the top? Or, why was I okay the last few days and today I've got a bit of a severe pain? Has something gone wrong with the joint? I can assure you 99%, having talked to the consultants and stuff and my surgeon, it's got nothing to do with the joint. It's just your muscles healing, and they'll heal at different rates. And part of the healing process is actually some days they'll feel fine, and then a few days later they might be really sore and tender. That's all just part of the healing process. But be reassured, surgery's gone well, your joint is intact and there's nothing wrong with it.
It's like you said about recovery not being a linear thing, but that sort of day-to-day things can change, but over time, from 1 week to another, from 1 month to another, yes, you will see the difference.
Yes, that's right. Just take the long view, and day to day, just just don't get upset if it's not linear, as I said.
Yeah. And of course, if you do have a serious concern, of course, raise it with your surgeon or speak with your physiotherapist about any new exercise or activity before you start it. But then there's things that can help to sort of give a sense of control within that process of moving from the day to day to the week to week to the month to month, whether it's tracking your progress in an app such as the myrecovery app, or if you're using the JointSchool app, or keeping a journal, keeping a recovery journal, or filming some short videos for Instagram, such as what you've been doing.
Exactly.
All things that can help.
Yeah, just give yourself small markers. I mean, what worked for me was to say, okay, by the end of week 2, I want to do 1,000 steps, and I did 1,000 steps. By the end of week 3, okay, I want to double that to 2,000 steps. And then by the end of week 4, I want to do 5,000 steps. And now I'm at about 10,000 steps, which is about an hour's walk at week 6 or 7. And these are just steps. Yeah. And again, not one size fits all, but they were just my markers that worked for me. If you're more advanced and you could want to have other markers, but for me that kind of worked. Steps. Now, depending on your age and where you are, not everyone's going to be able to do steps, but it might just be, okay, week 1, I want to try and just get out of bed. Week 2, I want to, at least walk to the kitchen and back and be able to make a cup of tea, whatever.
Absolutely.
I mean, there's no right or wrong answer.
The key thing there, I think, Sonny, is about setting goals. And I think that can make such a difference. I know that from personal experience of recovering from surgery. I know that from the conversations I have with people who are on the road to recovery, such as yourself, Sonny. And also, there's a lot of research to show that setting clear goals, like what's SMART goals is one sort of acronym that's used. You're setting goals that are, that are clear and meaningful to you, that have a set date, and there can be a mix of things to do. Like today, I'm gonna, get out of bed and walk through the kitchen or whatever it might be, and then you might have more long-term goals that by, towards the summer, I'm going to do this, that, or the other with some friends, and so.
Yeah, absolutely.
Helping to set some like long-term targets as well as a sort of day-to-day goal can really help to keep you motivated, and also as you reflect back on previous goals to give you a sense, well, actually things are changing. I am on the road to recovery here. We are moving on, and it gives that bit of extra reassurance for the days where you may take a few steps back, because odds are that's going to happen too.
Yeah, don't rush it, guys. My experience, and I've been learning this myself. You've got a new joint. That should hopefully last you 15, 20 years beyond. What's 6 weeks, 6 months to get to full recovery? So don't rush it. You've got something that you've got a 20-year outlook on this thing, 25-year outlook. So just be patient. Yeah. It will come.
But you know what, Sonny? Before we do the 25-year follow-up interview, we've got one to do. The next key checkpoint, generally speaking, for most people, will be sort of around the 3-month mark.
Yeah, that's when my appointment is booked in, actually. So my appointment's booked in for the middle of December. Yeah. Which will actually be 4 months for me. I mean, it was 3 months from when I last went in last week, and that's where my consultant will do. What will be another X-ray just to make sure that the joints bedded in properly, and then just do I guess that might be the final discharge point. I don't know, but let's see what happens then.
Indeed. Well, thank you so much, everyone who's tuned in. Thank you, Sonny, for joining us for another session. And we wish you all the very best until December, and we'll check in again and see how you're doing around then.
Yeah, fantastic. And if anyone's on the list and due to have one shortly, don't worry, it will be fine. Do your prep, do your research, and just be realistic on your expectations for the procedure and the recovery that follows. And good luck.
Yeah, super. Thank you, Sonny. And again, thank you, everyone. Keep up the good work. Stay safe out there. If you have any questions about this session or any other questions or about where you are up to, please send them in, or if you have a suggestion for a topic for us to cover, we'll get to it. Bye now, and we'll see you next time. Take care, everyone.